Thank you so much. I appreciate it. Dr. Zucker, thank you for being here. I want to follow up on the small business situation. The hospitality industry has been devastated by this pandemic, and the lockdowns have been unfortunately far worse. By your own data, which I'm questioning to begin with, your own data, only 1.4% of infections are coming from restaurants, and yet these lockdowns and restrictions continue. Just when we thought we were kind of getting out of the woods, you released information on guidance on special events. And at a wedding, you cannot have people that are unrelated sitting at the same table, according to the Department of Health guidance that we received. However, at a restaurant, you could have 10 unrelated people sitting at the same table. What science are you relying on to determine that people at a wedding have to be related, but not at a restaurant? That's my first question.
So part of this, you have to look at the guidance. Let me see if I can explain some of this to you on the restaurants and the way things were set up. The environmental issues come into play as to why the speed at which we're opening different facilities and restaurants, particularly downstate. I'm just going to bring up some points which I've heard that you basically have put a light on.
Well, I have a real basic question. How are 10 people sitting at a table at a restaurant different than 10 people sitting at a restaurant at a wedding, which by the way could be the same restaurant?
Well, at a wedding of 500 people, let's say, or 300 people that are interacting, you have a lot more interactions among a lot of different people there, right? And so you run the risk of a significant problem. I will just personally tell you, a year ago in January, up in New Rochelle, before this all began, I was at a wedding with 500, 600 people, and I sort of said that the amount of interaction that people had at that point in time, I said to myself, imagine if this COVID issue was just 1 month later, or the wedding was 1 month later, the amount of interaction we would have had with all those different people. So that's the difference.
But I'm just saying it's not. They're limited to 150 people, first of all. So it doesn't make a difference. And I apologize. I don't mean to cut you off, but I have a short period of time. Here's my other question. My wife and I both had COVID, and luckily we recovered. But we spoke with contact tracers. The contact tracers asked us, do you know where you got where you contracted COVID? And we said no. And then they said, well, have you been at restaurants? Yes. Have you been in stores? Yes. My question is, how can your contact tracer data be accurate when you don't have a category for unknown? I have to believe that most people cannot pinpoint the point at which they actually contracted COVID, yet your data, there is no option for contact tracers to hit unknown. How do you justify this data, which you're using to determine the life and death of businesses right now, when you don't have an actual category for unknown?
Well, we've reached 85 to 90% of people. We've done about 840,000 contacts or so, somewhere in that range. We have about 8,000 or so contact traces. This is a hard part of contact tracing. You have to sort of try to get as much information as you can, as quickly as you can, and you have to try to track the individuals who are positive, or individuals, better to say, individuals who have been exposed, to be sure that they're not positive.
So at the end of the day, the contact tracers are just guessing, is really what you're saying. That
if they get something,
can't pinpoint it.
But
there is no unknown. What about what I did? I don't know where I got my where I contracted that, and that wasn't an option for the contact tracer.
Right.
I know my time is up, but that's a serious consideration.
Right. But I will say that contact tracing and what we have done is what has helped prevent the spread of this disease. I mean, these are just straightforward public health measures that are put into place. The masks, the hand washing, right, the distance, social distancing, the contact tracing, the vaccinations. These are just the standard things we do to make sure we prevent this pandemic from spreading in New York and elsewhere, for that matter.
Well, and with all respect, tough. Sir, we have more people in the hospital with COVID right now than Florida with none of those restrictions. So I have to question the science on this.
I may take issue with that.